Wow, this is 30 minutes. It's going to go fast. So I'm very, very nervous. También estoy súper con mucha energía. Thank you so much. I'm very energized. Though I am one of very, very bad public speaker because I get very nervous at the beginning and then I start cramping up and I don't know what I'm saying. But I want to reassure you that I prepared this presentation very carefully with Elizabeth's help. I love the music too. If you like salsa, there's gonna start salsa dancing at the deck in the harbor in Canton. If you want to know more about it, I can definitely tell you. So let me see if I can, just trying to share my screen, but I cannot find my icon. Sorry about that. Well, welcome everybody. Thank you so much for the opportunity to talk with you today. I bet some of you are having lunch. If you're not having lunch and you feel comfortable, feel free to open your cameras. I'm going to be sharing my screen anyway. So welcome. My name is Mónica Guerrero Vázquez. I am originally from Ecuador, and I have been working at Centro SOL since 2014. Our center was funded in 2013 by the Strauss Foundation with some support from Johns Hopkins. And this thing here is a poster that our Family Advisory Board did in 2014. So they're representative of the work that we do. Okay, let me share my screen. Look at that. Do you all see my slides?
Yes.
Okay, thank you. Centro SOL is a Johns Hopkins Center for Salud, or Health and Opportunities for Latinos. I wanted to start with some headlines about who we are, what's happening in the city, and as you probably know, the census was released last year. I was very excited, very eager to see the census data. We had a census campaign with our community members and health promoters to talk with people and educate them about the census. And we have experienced and witnessing the growth of the Latino population. However, the census was released and we saw that the population decline in Baltimore City, 5% in the past decade since 2010. And the city has now less than 600,000 people, even though it was built to host 1 million people. So we have like less than about half of the population that the city can host. We also saw the increase of the diversity in the city and at the state level. Latinos in the city increase in the city more than 75%, and in the county more than 50%. And I will show some graphic later. Maryland is one of the top 5 most diverse states in the country, which is pretty cool. And I think we see more of that in Baltimore City. 45,000 people are self-identify as Latinos in Baltimore, and about 61,000 in the county. Those were very meaningful numbers for my work and for the work that we do at Centro SOL, because I often hear the comment of, oh, but there aren't too many Latinos. To my question of, do we have interpretation for this? Oh, but there aren't too many. So I think 45,000 in a city of less than 600,000 is a very significant number now. And I was very excited about that. These just pictures the increase from 2010 to 2020 census. The increase has been over 130% of the overall population, Latino population increase. So in the city, we went from 4% to 8%, and in the county from roughly 5% to about 7% of the population, Latino population. What does that mean? That means that we need to ask ourselves questions as, do we have the appropriate services? Are we culturally and linguistically equipped to serve this community? So Centro SOL is located in the Bayview campus because this is kind of the niche of where the community, Latino community has started to grow and then expanded. But it has really been expanding north and south. And Centro SOL was founded, as I mentioned earlier, in 2013 by physicians who started to see this new community. Most of them came through the emergency services. Some of them were mothers who didn't have any prenatal care and then came here to deliver their babies. They didn't speak English. Some of them even don't speak Spanish as their first language. And they didn't have any resources or system that can provide support to this community. So trying to understand what their needs are, who they were, what the resources we have, and how can we equip our system to serve this community. A group of physicians came together. They created a group called OLA. And from there, we were able to get funding from the Strauss Foundation to get our center running here. Our mission, which is in the center, is to promote equity in health and opportunities for Latinos in collaboration with community organizations and public agencies. We do this so that we want to see equity for all in all areas, including refugees, asylum seekers, and immigrants from anywhere, especially try to represent our diversity. And our goals are to promote clinical innovation. So we don't have a clinical place. So my dream is one day to have a physical center where we can have walk-ins and people come in to receive services. But for now, we have clinical innovations. We collaborate with the Esperanza Center, which is a community-based organization that provides clinical primary care. Our co-director, Dr. Page, is the medical director of the TAP program at Johns Hopkins that provides specialty care for people who are uninsured, and 90% of those people are Latinos. We also work advocating for diversifying the workforce and education. If we want to see diversity, we have to start now and we have to start early. We work with high school students. Some of them are immigrants, some of them are first generation born in Baltimore, Baltimoreans, and most of them are bilingual, though I have to say not all the Latino youth are bilingual. They don't speak Spanish, but most of them are, and we would like to see them becoming our future nurses and registrars and doctors. And I said that we established the Centro SOL to promote equity and to understand what their needs are. We promote innovative research and practices that I will describe a little bit more later. And we also try to collaborate to promote just policy and systems change. So it's not all about programs, but also we need to advocate for policies. We have strong community participations. We have advisory board and we have language services in a way. I think one of the added values that I have in my job is that I speak Spanish. I'm an immigrant myself. I always try to depict how Centro SOL looks like. And then I ended up thinking, oh, this can actually be like the Milky Way, right? So the stars around the sun are our core programming and research areas. So we do a lot of work on mental health, physical health, infectious diseases, child and adolescent health. We do a lot of community outreach. My background is computer science, so my main work was outreach and community service, and through that I transitioned to public health. We also do advocacy and equity, something that I just mentioned earlier, research and clinical innovations, trying to incorporate and represent the community in the work that we do. And we want to diversify the workforce. We're trying to have representation and make our youth programming stronger. But we also have some moons here, like we have maternal health, diabetes prevention, adult and child obesity, and individual and group wellness. We hope to start running soon. So if anyone wants to join to our running group, let me know. You're more than welcome. I'm going to talk quickly about some of the programs. Youth I already mentioned this. We have 24 youth right now in our program and 7 leaders, young leaders. All of them are high school students. 24 youth, of those 15 are immigrants. Some of them are newly arrived, and the rest are first generation Baltimoreans. They want to become doctors in the future. Some of them want to be social workers. And the young leaders are youth who have already been part of our program, and they are giving advice to some of the research and the work that we do, but also we do work in collaboration with the School of Public Health. In the summer, we host during the school year, we host a mentoring program, and during the summer, we host a summer program where all the youth receive a stipend and they learn about skills, they receive they get exposed to different careers. And they also, this year, they are going to be implementing a public health program. So stay tuned because we will need mentors for the youth in the summer. For community outreach, we started, as I said, I started doing community outreach, going to the community and running programs and events. But then you get to see this power in the community. People are eager to do things and see the growth and build their communities. Sometimes they just don't have the tools or the means to do it. So some of the women who, mostly women, do I have some men in the programs, but mostly women who have been participating in our programs, for example, in the wellness program, the diabetes prevention program, or the parent program, they become leaders in their communities. So some of the ladies who you see in these pictures are currently leading efforts. The two on the right are leading food access programs right now. We have 3 sites distributing food in the city, and they are running the program. I provide the tools, but they run the program. They have so much eagerness to support their communities. And the picture on the right, they are our mental health ambassadors. So they are very interested. They have been part of our mental health support group. And now they are educating the communities on what mental health is. And they are very mindful about how they give that information. So it's not us telling people how they have to perceive mental health, but they are having that conversation and educating the community about what it is and how to find for help. So the community is rich where we can find potential workforce. We have direct connection with the community on a day-to-day basis, and we're trying to understand their challenges and overcome those challenges with them. For research, we have been trying to do institutional engagement in the community. So working with the ICTR, the Institute for Clinical and Translational Research, we're trying to be present and be more meaningful and mindful about how we do research. There is an important role for our advisory boards. For the members that I just mentioned earlier, they can be part of our research projects. They can give us advice and tell us how we are doing. We reviewed last year the consent process and how challenging it was to work with uninsured individuals and expect them to come to research if our consent process is not even translated. The full consent is not institutional. There's not a standard translation for that. We also work with community members to engage in the planning, implementation, and evaluation of our programs and research. And that's something that is a very good practice, not only done here in Baltimore, but it's done in states like California or New York. And we ask them how and we also provide feedback. That's an important practice when we work with marginalized communities, is when we go there and recruit participants, we have the duty to go there and report how the progress of research is. An example of how we have done this work, innovative and inclusive work with the community, is the mental health programming. We created this program to understand the stigma in the Latino community around mental health and depression. And we piloted an intervention to treat depression in the community. The campaign, the one that you see on the right with this little brain and hearts and butterfly icon, is called Strengthening Your Well-Being. When we talk about mental health, the community members told us, don't mention mental health. We don't really know what it is. We don't talk about it. However, we understand what well-being is. and we know how important mental health and physical health can be connected. So the campaign is fully in Spanish, and it was informed by community participants. We also have programming for youth. We have a program called Testimonios that was replicated in Teen Testimonios. So these are support groups that are based on storytelling. People learn how to recognize their feelings and how to share their feelings with groups. And particularly, they identify where the resources are. So the cultural competency or cultural appropriateness comes not only from us identifying resources in Spanish, but talking to people about why and where they go when they need to find a resource. For example, the other day we had a group and we were telling them, where do you go to find help? And they said, we go to churches and schools. And I asked them, do you get the help that you need there? Their answer was, I only go there because they will be able to connect me with resources. I don't go there because they're going to resolve my problem, but they are the hub. So that is super powerful, because if we want to provide a service for the community, the place to connect may be churches or schools, which is where community members go. And as I said, we talk to people about what their needs are, what they want to do, and what works for them in research and in programming. For COVID-19, our center and our team was championing a lot of the efforts to serve the Latino community. We work with the ICTR, the Institute of Clinical and Translational Research, and we work with the IRB office to discuss how can we be better at translating materials to Spanish. Why are we still, during COVID and the pandemic, not having language services available? So we're trying to have that conversation. And fortunately, we were translating materials for research projects. And after several years, we were able to transition and send it to Johns Hopkins. So now Johns Hopkins Language Services provides that support to researchers who need materials translated if they want to include. The translation is not the only thing that we should do to include community members. It's also identifying the needs. We collaborated with the Mayor's Office of Immigrant Affairs and other community-based organizations to promote the vaccine accessibility, to give information. We were part of the vaccine task force in the city to disseminate the results of the data that they were sharing with us at the state and at the city level. We created the food access program. We serve way more than 450 families a week, and that is super powerful. We don't only provide fresh vegetables, we also get the culturally appropriate food. So we get beans, we get corn flour, and we get oil. We get things that they need to feed a family of 4 for an entire week. During COVID, we increased our resources for mental health. So we hosted support groups for people who were hospitalized, because being hospitalized by COVID-19 with COVID-19 was not an easy process. And when they came out, they just found themselves that they couldn't do self-management and self-care. They felt very tired. And in addition to that, they weren't insured, and paying for the cost or the stress or the fear of the cost for care was very stressful for them. So we were meeting with them. And then we started Hora del Café. So we were meeting on Facebook to have conversations with community members, providing resources about COVID, and also answering questions, stigmatizing what COVID was, what the vaccines were, where people could get access. We have weekly conversations now on Facebook, and we talk mental health, and we talk physical health, and also services that they may need in Spanish. And we did a lot of work for vaccine distribution outreach. I don't know if you're familiar, Dr. Page spearheaded the clinic, the community clinic in Highland Town in collaboration with Sacred Heart. We got a small grant from the health department to do community outreach on vaccines and COVID response. So this is just a summary of all the work that our team was able to do in response to the COVID crisis. We do have some publications in place. You can check our website for publications and research projects. Mental health is a very strong project right now, but we also did information and education of the community, and we also have projects for mothers and for babies and mental health. We are currently running a project on obesity prevention and treatment for children. So you can have definitely more information on our website. In summary about what you can do if you do research or programming is to plan soon and plan ahead. Questions that have been very helpful through our work and through the collaborations with other groups is, do you have a representative sample in your programs and research? We know that now the city has 8% of Latino population. Do you have a representative sample in your project? Do you have the resources? Are you talking with partners right now, community partners, to build that trust with them when it's time for recruitment? Are you investing in your local community? And I know this is like very difficult and very complicated to ask for the work that we are doing, but how can we be creative about that work? Is there any translation or research that we can implement? Is there any educational materials that we can share with our community partners? And do you have enough in your budget for bilingual materials? Again, translation is not enough to serve non-English speakers. Translations are expensive, interpretation is expensive, and the sooner you think about those things, the more prepared you will be later. How can you build this, or how can you build momentum for your grants, for example, when you have to add a budget line for translations? Is because if you're intentional about the goals of your project and incorporating diversity and incorporating the voices of communities who don't speak English, it's not very complicated to convince funders usually about the importance of incorporating this. And also there is literature or gap in literature about the values or the value of adding non-English speakers in research, but also if in a particular program of research you don't have enough representation, like what you can do to include that in the work that you do. You can find more information on our research page on our website. We have an FAQ with more resources about how we can include and support recruitment of Latinos. Johns Hopkins has a very nice platform. So speaking of investing in the community and building trust with community partners, Hopkins Engage is a wonderful platform where you will find other groups, other community members, other volunteering opportunities. I'm gonna plug for our center, so you can find in Hopkins Engage on our volunteer website, the Centro SOL page. And if you join, it will be super easy. You will get notifications when there are volunteering opportunities. We have a conference coming up in May that I forgot to include here, but I can share the link with you all. The conference is going to be around mental health because this is the year for mental health for us. Also, May is the Mental Health Awareness Month, and we will have the conference on May 19th. So we will need volunteers for that conference. If you're interested, you can also sign up here, but there are other opportunities to collaborate with the community. And every year we host a holiday drive where we give gifts to families. This past year, we were able to serve 1,000 individuals, and everyone in the house received a gift. It could be big or small, but everyone received a gift, and the donations are very, very helpful for us. So this is all I have for you today. We had to go virtual due to COVID, but hopefully we will be going in person soon. We have started some activities in the community, like the mental health ambassadors who are going out to educate our communities. The conference in May will be in person too. You can follow us on Instagram, Facebook, Twitter, and now we have a TikTok page. So I still have to generate content for that. And we also are on LinkedIn. So I think we still have a few minutes for questions or comments. Thank you.
Thank you so much, Monica. That was wonderful. I learned a lot, and I hope the audience did too. We have about 4 minutes for questions. So if you have anything you'd like to bring up, please unmute or raise your hand, and I will make a note of that. But I can go ahead and get us started. So I was really, oh, Cecilia, you go ahead. I saw you.
Well, mine was just a comment, which was, it's shocking that we didn't have the our releases in other languages than English, and it seems so basic, but just an eye-opener about kind of some of the barriers that we in the majority culture don't think about.
Thank you so much, Cecilia. You're right. The short forms are available in multiple languages, but the consent form is not. So what we were trying to do when we had our translation service was to kind of generate a template with the legal and the formal text that could not be edited, try to be the same, because if you send the languages are so rich that the same sentence can be translated in different ways and have the same meaning. So we were trying to stick as standard as possible. Yeah.
And speaking in terms of translations, I was just so shocked to hear your example of using well-being instead of mental health. So if you were to translate a sentence talking about mental health in Google Translate, it would say mental health. But in reality, the community members have said that well-being is the term that they would prefer to use. And so just the importance of recognizing that the language is not, the direct translation is just not always the best translation. That was really interesting.
It was very interesting for us to learn that too. We got almost 400 people answering questions about stigma around mental health and depression. And many of them know what depression is. They talked about it. There's a lot of stigma around it, of course. And when we came to how to change that, we said, okay, we're going to talk. And what is mental health for you? You know, like, tell us, what's depression? And I remember we were drawing a map because it was still in person, and they were trying. It was very hard for them to really give resources around mental health. But then they said, well, someone said, but we don't really say mental health. Like, if you talk about mental health, it's like people, the first reaction that people have is like they are crazy, and nobody wants to be labeled as that. So we started navigating, and this was like a whole different thing that we were expecting for the project. We started to talk, okay, so if it's not mental health, what is it? And yeah, well-being seemed the most appropriate term when we refer to mental health for this particular project, but always asking them is the best way to go.
Whatever it takes to reach the community, right? So I think we're going to go ahead and wrap up today's session. We are approaching 12:30. Thank you all so much for being here today. I'm very grateful I could spend some of my lunch hour with you. Monica, do you have a final sentence or something you would like to share with us before we head off?
Thank you so much for being here. That means a lot. That means that you care. And I hope this information is helpful and that you can translate that to your work or your community work. And I invite you all to join us in our activities, but also in May for our mental health event. Thank you.
You did a great job, Monica.
Thank you so much.
Thank you all. Have a good afternoon.